co-presenting-ish. I was just told that. So my name is Damon, Cathey. I'm the community superintendent for the Northeast Quadrant.
And I'm Dawana. I am with Noah.
And so my part on the program is listed as vision. And so when you think about Metro Nashville's vision, the vision is to become the fastest improving urban school district in America. The challenge there is realizing that becoming the fastest improving district in America requires more than just the work of a school. It requires that schools involve communities in meaningful ways, that students are involved in relevant work, and that we think about the entire child. And I think that's what we are here for tonight. How do we really get at what our students bring to school, and how do we think, instead of from a deficit model, think from a model of strength and work in that area of strength to help them meet their goals. And so as a district, there are some things that we're committed to this year, and we're excited about moving forward with our budget. We're excited that the board heard not just our concerns, but the concerns of our community. And so there are some very specific things that we'll be putting in place next year. As teachers and principals sit and decide on a Tier 1 model to deal with student challenges, we will make sure that there's training for all teachers. And Dr. Huth described, there will be training around restorative practices, around PBIS. There will be training around trauma-informed instruction and around classroom management. We also want to make sure that we are providing wraparound services. And so we want to make sure that our psychologists, our behavior specialists, and our social workers that are now in the budget are in the classrooms, in the schools, helping to be a part of the solution. Then we also want to increase students' exposure to college and career opportunities. We know that oftentimes students react because of a lack of knowledge. It's not because of a willfulness around just being disruptive, but it's a lack of knowledge in opportunities, a lack of knowledge about the path that's necessary for them to achieve at different levels. And so we are very excited about adding college and career counselors to our high schools that can begin at a very early grade level, exposing students to those opportunities, especially here in Nashville, the Athens of the South. And so we're excited about that. We want to expand our Community Achieves program. And Community Achieves has had a lot of success in different areas in our district, thank you. And so we want to make sure that we expand that, because it's also important that students are in school, a real challenge. And that pattern typically begins at pre-K. And oftentimes people are surprised to hear that, but we know from the research that if students do not attend school regularly in pre-K and K, that pattern typically follows them throughout their school years. And then we also want to make sure that we're in a good partnership with juvenile court and the Student Attendance Center to provide resources, not just to be punitive, but to provide resources for parents, for families, as they are tackling real challenges like these students so beautifully described. It's a challenge if students can't get to school, and oftentimes students become the bearers of the punishment around that. But we want to make sure that we're partnering in a way that we support families and provide our students and families with resources to help them be present in school. So I'm going to stop for a second, and then I'll come back up if I need to.
Oh, you'll be needed. Don't go anywhere. Thank you, Dr. Cathey, very much. You all have heard the vision from Metro Schools, and we're very thankful for that and believe in that. And you all should have received, when you came in, good information, a packet of information, and it's a lot of information. And Noah has been working with the school system, directly with Dr. Joseph and Dr. Narcisse and Dr. Majors, around specific kinds of things that we wanted to see in the budget. And we've invited you all to many, many meetings. We've invited you all out to Temple Church and to community engagement meetings to talk about these things. And we are seeing the fruition of that in these things being added into the budget. And so I am excited about the progress that has been made over the last couple of years relative to that, because a couple of years ago, there were 1 or 2 restorative practices, trainers and things in the district. And then this year, we were able to increase that, I think, to 4 this year. And next year, as a result of the $1.2 million that have been added into the budget specifically around social emotional learning and restorative practices, as well as the positive behavior intervention system, we are expecting even greater results that you just heard about at Englewood Elementary. And so we're thankful that NOAA has had an opportunity to partner with Metro in doing that. And I just want to bring just a little bit of information to you tonight relative to new positions for 2018-2019, because all throughout this very challenging budget process, we, NOAA, and all that we have been talking about in all of our engagements with the school system, have said to Dr. Joseph, this is what we expect. This is who we're going to bring to all of these meetings and all of these budget hearings so that you all understand that the community is interested in this. Because what happened at Englewood and what's happening at Hillsborough doesn't just happen. There has to be support for it. There has to be funding for it. And so new positions for 2018 specific to social emotional learning, I'm not going to read them all to you, but I do want you all to pay attention to this document, because as the budget system and season continues, we will remain committed to making sure that this happens. We can only do that with you in this room and with your friends and with the people that you have influence with, so that we can make sure that the young people at Englewood, the young people at Hillsborough, the young people at all of the schools across the district get what they need relative to social emotional learning. It doesn't make sense if we have these resources available that young people have to wait till they become adults to take advantage of them. We want them in the schools where they have access to them. And most teachers will tell you, and I'm a fan of teachers, they will tell you we shouldn't have to do these things. There's a lot of stuff we shouldn't have to do. Unfortunately, we're at a time where we have to do it. And we have the expertise. We're working to make sure we have the funding. And then we need the support of all of the people in this room to make sure that it happens. Because a vision without work, a vision without it being on paper, a vision without funding is simply a dream. And I believe that we have the power right here in this room, right here with all of these people here, to make this vision become reality for our children, just like it has at Hillsborough, just like it has at Englewood. And that's not saying that all of the things that happen in schools are perfect. These are some baby steps. Baby steps were taken 2 years ago. More baby steps were taken. I think we might be doing a little more than baby stepping. I think we're going to be doing a little running next year. And so, specifically, four additional quadrant-based social emotional learning specialists, 2 additional cluster-based behavior analysts, 1 classroom management specialist, 4 pre-K social emotional learning coaches. We like to pretend that the babies are all cute and all those things, and they are. And they also are dealing with adverse childhood experiences that affect them when they come to school, and they cannot sit down and do what needs to be done so that they can learn. We have the capacity to make a change. We're relying on Dr. Joseph and his team and Dr. Cathey and everyone in this room to help us to make that happen. I believe we can do it. I know we can do it. I know we will do it. You all should have received, when you came in, some index cards. We're going to have a Q&A session after Dr. Cathey comes up and maybe shares a little bit more. But we want you to ask questions in here tonight so that you can get the information you need, so that when you go back out into the community, you can share exactly what needs to be shared and get it directly from the school system. Thank you.